Margaret had been a nurse at Trans-Allegheny for only 3 months. When Dr. Freeman arrived with his leather case of instruments, it was 1951, and the asylum was overcrowded. Nearly 2,400 patients crammed into a building meant for 250. Progress, the doctor called it, holding up the ice pick-like tool that would forever change everything Margaret knew about mercy. She watched in horror as patient after patient was wheeled into the makeshift operating room. Mrs. Henderson, admitted for hysteria after losing her son in the war. James, whose only crime was loving another man. Children diagnosed with conditions we'd now recognize as autism or ADHD. The procedure took minutes. A few taps above the eye socket, a swift insertion, a twist, then silence. Margaret's first night shift after the lobotomies began haunts her still. The ward that once echoed with cries and laughter had become a tomb of the living. 37 patients sat motionless, their eyes vacant, staring at walls that held no answers. But it was the sounds that nearly broke her. Soft shuffling of bare feet at 3 a.m. Following the noise, she'd find empty hallways, yet the footsteps continued, always leading toward the surgical wing. Some nights, she swore she could hear Mrs. Henderson humming a lullaby for her lost boy, though Mrs. Henderson hadn't spoken since her surgery. Margaret quit the day she saw them all, dozens of translucent patients wandering, retracing their final walk to the operating room, forever searching for the pieces of themselves they'd lost. The asylum closed in 1994, but Margaret, now 89, still drives past sometimes. She swears the building weeps, and on quiet nights, you can still hear the shuffling footsteps of those who never found their way back to who they used to be.